Hello all, I am dr.Rabiya, practicing as gynecologist, obstetrician and fertility specialist in Vijayawada. Today, let us see about cervical cancer. Cervical cancer is the second most common cause of cancer in women. It affects about one-fourth of the population of cancers in India. And most of the people who are living in the rural areas, they get affected with the cervical cancer. What is a cervical cancer? You usually have uterus and the lower part of the uterus is called the cervix. So that is the part which is getting affected because it's usually exposed to the vagina, to the outer environment. And etiology, if you have multiple sexual partners or if you practice improper vaginal hygiene and other things, you are at risk of getting this. And HPV virus, human papilloma virus, is something which is a major positive factor for this cervical cancer. So symptoms usually they are minimal in the initial stages and most of the symptoms get unnoticed, like in the form of vaginal discharge, intermenstrual spotting, bleeding after intercourse, postmenopausal bleeding in old lady, and sometimes mass in the vagina. And usually some people find foul smelling discharge from the vagina in the postmenopausal cases. So after attaining of the menopause, if there is bleeding, you have to consult your gynecologist. And in the earlier stages also, the routine screening method of pap smear is being done in most of the hospitals. And I request all of you to get a routine pap smear done before the age of 40 years in order to detect it in the early stages. And we have a cancer vaccine, cervical cancer vaccine, which is usually used between the age of 9 to 14 years. And this is the ideal age where the person doesn't get sexually involved and it affects maximum. So the cervical cancer vaccine can be given in the form of 2 doses at 0 and 6 months. So within a gap of 6 months, if 2 doses are given between 9 to 14 years, it's usually effective. And if your age is greater than 15 years and you are below 45 years, then you have to take 3 doses because 0, 1 and 6. So these 3 doses will completely protect you from cervical cancer. HPV vaccine is also protecting you from genital warts and HPV virus also. So in case of vaccine, if you take the vaccine, 75% efficacy is there for preventing of cervical cancer and 100% efficacy